So, good afternoon, friends. Today, I want to share one more case with you. It's an interesting case, and according the remedy which I have used in that case. So, it is nearly about 3 years have been already passed. Uh, there was a call from one of the physician from Sangam. He asked me, Doctor, I will send you one case. Patient is not there. You will get only the reports. Patient's age is more than 90. He is bedridden, not able to even turn in the bed. Is a case of uremia. The creatinine level is nearly about 10.2 or 3. The blood urea is much higher, and he is presently having the typical uremic vomitings continuously, not able to ingest anything. His grandson came with big reports. It was a case of renal failure at the age of 90 plus, nearly about 90 to 93. And he said that since last 6 months, we are all disturbed because he is not allowing anyone to leave the room. And he's so restless, turning in the bed. He's not able to ingest anything. Everything liquid diet is going on. And it is also vomited. Doctor said there is nothing in our pathy now, and he asked that you start homeopathic treatment. And they send me. And these are the all reports are there. I asked how this has started. And he said very interesting story. He said that 6 months back he had a severe itching all over the body. It was called to be a dermatitis by the skin specialist, and there was a there were multiple ointments were provided for that patient. So all ointments were applied. They have given certain medicines for that. Till that period, everything was going on fine. It was diagnosed as a senile dermatitis, and thereafter, after applying those medicines, immediately he started getting a edema all over the body. So we took patient to the physician. He said that his creatinine is increased. It was 2.5, etc. He started medicines, and thereafter the medicines continued since last 6 months, but it has reached to the 10.2 at present, and patient is in a worst condition now. So what to do? And this is the only case because patient is not there. Asked whether you have a photograph or a video of the patient. He said yes. And when I saw the photograph and even small video which was there in the patient's mobile, I was surprised. In fact, at the age of 90 plus, his body, he is quite strong in by body, and that's why he survived for such a longer time of duration. I have observed one more thing in that patient, that his ears are quite long. Generally, this is my observation that those who are having long ears live a longer life. Renal reading, I don't know whether it is there or no significance, but this is my personal reading. At the age of 90 plus, when patient goes into the kidney affection, there must be something wrong. Otherwise, he was living a very perfect life. So what was the problem? The problem was that it was an acute renal failure leading towards the chronic one, and just because of the suppression of senile dermatitis by allopathic medication. So this was my plain reading, nothing else. Considering the miasm, when these things happens at the age of 90 plus, the miasm is definitely a SORA, not a psychotic or syphilitic. It is not destruction. In fact, if he would have not applied any ointment, he would have survived and not had a renal failure. So, a simple thing which was there in my mind to consider one remedy, that is the sulfur, plainly as a local application, as a constitutional, and along with that, in such types of cases, I used to use one important remedy, and that is called as Eel Serum. In fact, this remedy I have started using in last 6 7 years, or in fact 10 years, but it is a very good remedy. In Boericke's Materia Medica, we have in Boericke's Materia Medica, we have it by the name of Serum Anguillar Ichthyotoxin. It is a Eel serum. It is Eel serum, and this Eel serum is a very important remedy from our Materia Medica. Basically, when the patient is in ICU, whenever a patient is in acute renal failure, whenever the acute renal failure is induced because of some acute infection, acute pathology, one more important thing which is there in Eel serum is that whenever there is an hypertension associated with oliguria and associated without having an edema, then definitely think of the Eel serum. This is very important remedy. In the ICU, this remedy plays a very vital role. In fact, it reverses acute renal failure so fast and patient improves. That's what my experience was. So I have prescribed that remedy. It was decided for that patient that now his age is 90 plus, 92 plus, and he will not survive. They have taken only a chance. But to my surprise, since last 3 years, he is absolutely normal. Now he is running nearly about 95, 96, and he came to my OPD 4 5 times, and his age is 95 plus. He is eating normally. He has improved completely. His serum creatinine is around 2. Blood urea came down to normal. Everything is normal, and he is living a very normal life. It was a surprise for me. But only one thing has happened, that after starting the medicine, his eczema returned. As that nothing doing for the eczema. Let us continue with the medicine, and that's all. And he has improved to such a level. So at the age of 95, if patient is walking for certain distance, used to come to OPD and improving, it means that he is in a state of health now. So this remedy I want to share with you in today's session. So my dear friends, let us learn sentence by sentence from Boericke's Materia Medica, because it has a lot of meaning. See what he says: the serum of the eel has toxic action on the blood, rapidly destroying its globules. What he says: the serum of the eel has a toxic action. It is toxin, that's why it is called as ichthyotoxin. Its specific action is on blood, rapidly destroying the red blood corpuscles. That's why anemia which develops over there. So it has a hemolytic action. The presence of albumin and renal element in the urine, the hemoglobin urea, the prolonged anuria, nearly about 24 to 26 hours, together with the results of the autopsy, plainly demonstrate its elective action on the kidneys. So this is what the practical understanding of the remedy. What it used to produce? It used to produce specifically a hemoglobin urea, because of which the nephrotoxicity, a prolonged anuria, the urine becomes blocked, and together with the results of autopsy. So this is what happens over there. Secondarily, the liver and heart are affected. Two important things. Liver is also affected, at the same time the heart is also affected. Both things are affected, and alterations observed are those usually present in infectious diseases. See, this is post-infection problems. Post-infection, the cardiotoxicity, the nephrotoxicity, this remedy plays very vital role. So, any patient who suffers from any infective pathology, and after infective pathology, if he suffers because of cardiotoxicity or because of nephrotoxicity, one should not forget the Eel serum. If there is an anuria or acute renal failure, this remedy is very important remedy. From all these facts, it is easy to infer a priori a therapeutical indications of the serum of the eel. Whenever the kidney becomes acutely affected, either from cold or infection or intoxication, and the attack is characterized by oliguria, anuria, albuminuria, will find the L serum eminently efficacious to reestablish the IOSs and rapidly arresting the albuminuria. So, this is very important remedy in acute renal failure where there is an albumin is lost from the kidney. Urine contains lot of proteins and oliguria, less urination, and this has happened only because there it was suppressed. The in acute disorder, specifically in infectious disorders, whenever the kidneys gets blocked, to open the kidney, serum anguillar ichthyotoxin is a very good remedy. What he says, when during the course of heart disease, the kidneys, previously working well, should suddenly become affected and its function is inhibited. And when besides we observe cardiac irregularities and marked state of asystolia, we may yet expect good results from this serum. So this is a remedy when for priority heart is affected. Because of heart, there is less output and producing a renal insufficiency, leading to a albuminuria, oliguria. The serum anguillaris is very important remedy. The L serum plays very vital role in such types of cases. So when there is a irregular heartbeat, asystolia means a systole is missing in between. A ventricular systole is missing. So heart irregularities associated with oliguria, associated with the proteinuria, associated with or not associated with edema. This is the remedy one must think. What he says, but to determine here the choice of this remedy is not an easy matter because what he further says, while digitalis presents its indications, the well-known symptomatic triology, arterial hypertension, oliguria, and edema, the serum of the L seems better adapted to the cases of hypertension and oliguria without edema. See this what he says, digitalis is close to it, but in digitalis it is associated with cardiac failure. It is a remedy for the circulatory failure. CCF, congestive cardiac failure. It is the first remedy to be think of. Digitalis is basically it is heart priorly gets affected and then the kidneys gets affected. Because of circulatory failure, the kidneys are blocked. Then digitalis is one of the important remedy. But in digitalis, whenever CCF is there, there is always a passive venous congestion producing very typically a edema all over the body. So in digitalis, you get the edema. Here, you don't have edema. Two different actions, and that's why we can differentiate. So clinical understanding, clinical presentation, and understanding the pathology is very important when you prescribe for the pathological cases. So CPVC is quite common with digitalis, which is not there in cases of the L serum, and that's why it is easy to differentiate if we know all those things. So what he says, arterial hypertension, oliguria, and edema, the serum of the L seems better adapted to the cases of hypertension and oliguria without edema. We should bear in mind that the elective action of the L serum is on the kidneys, and I believe we can well assert that if digitalis is cardiac, the L serum is renal remedy. So here it differentiates. The digitalis is cardiac, whereas L serum is the renal remedy or kidney remedy. So far, at least the clinical observations published seems to confirm this distinction. The serum of the L has given very small results in attacks of asystolia, but it has been very efficacious in cardiac uremia. So this is again a good remedy. Whenever cardiac asystolia is also there associated with renal insufficiency leading to oliguria, L serum plays very vital role. There, where digitalis is powerless, the serum of the L has put an end to the renal obstruction and produced an abundant diuresis. So to produce diuresis, this is a good remedy. So whenever kidneys are blocked, you give the L serum and kidneys are open and diuresis happens and more urine. Just now I have treated one more case which was admitted in my friend's hospital. I used to meet daily to observe that patient, and she was again having very severe urinary tract infection with septicemia associated with COVID, and she is having increased creatinine level. It is an acute within span of 5-10 days. And when I went over there, I observed and I have started her on L serum. And after starting L serum, the kidneys are open and there is a severe diuresis. So she was consuming 1 liter of water and she was getting nearly about 1.5 liters of urine. Severe diuresis because it was already the blocked kidneys, which when opens, it produces more diuresis. That's what the thing is there with LC. But its really specific indication seems to be for acute nephritis a priori. Priori means a coldness, a severe cold conditions. So acute nephritis, a priori. So there is a acute nephritis associated with very typically a priori, coldness. Whenever there is cold conditions and producing acute nephritis, this remedy plays a very typical thing. Subacute nephritis. So see the now pathological materia medica. Subacute nephritis. So acute leading towards the chronic, and this remedy plays very vital role. It is not directly a chronic, but it is an acute or subacute nephritis. Heart disease in cases of failure of compensation and impending asystole. What is it? Heart diseases in cases of failure of compensation. Heart is failure to compensate the condition, and there is a impending asystole. It is going towards the asystole. Ventricle is not getting contracted properly. The experiments of Dr. Josette have amply demonstrated the rapid hematuria, albuminuria, and oliguria caused by it. So this was there, which he observed after the toxication. So this is a clinical observation in patient where it was considered to be a toxic effect, and it has produced hematuria, it has produced albuminuria, it has produced oliguria, which are the symptoms of the clinical symptoms of the remedy. In the presence of an acute nephritis with threatening uremia, we should always think of this serum. Very efficacious in the functional heart diseases. Very important thing which he is explaining over there. This remedy, whenever functional heart symptoms are there, associated with the nephrotoxicity, associated with the oliguria, associated with albuminuria, associated with sometimes hematuria, this remedy is very important remedy in such types of cases. Very efficacious in functional heart diseases, mitral insufficiency, asystolia, with or without edema, dyspnea, and difficult urinary secretions. So these are the very important indications which he tries to explain over there. Mitral insufficiency. So there is an insufficient supply of the blood from the mitral wall. So might be in cases of sometimes cardiac failure associated with the renal toxicity. This also works if the digitalis fails. Then he says asystolia with or without edema. But generally, in case of this remedy, we find it out edema is less, edema is not so much. And third important thing, dyspnea and difficult urination. So these are a very important indication for which this remedy is a very vital remedy. One should always keep it in your mind that if you are called for certain severe cases and you observe that there is a patient suffering from acute renal failure associated or followed by some acute infective focuses, and associated with less edema but oliguria. Never forget to use this L serum. And now remedy is quite available. Earlier, those remedies are the rare remedies which were not available, but nowadays these remedies we can get from request company. It 7x preparation, that is the dose which I used to use in such types of cases, and it works beautifully. So I have tried number of times the 7x potency which is prepared by request company. I used to use that first. So that is one, that is a remedy I used to use in such types of cases. Relationship, this is very important part of the Materia Medica. One should not forget what he says. Great analogy exists between L serum and the venom of Vipera. Vipera is also one more remedy which has a vascular action. But Vipera, you can get certain features. It has action on venous system more. So hanging down of the legs, producing an edema in the lower extremity with a very varicosity or sometimes even different thrombosis. Vipera is a very good remedy. Both are toxins. That is a Vipera poison. Here it is Serum Anguillar Ichthyotoxin. Both are toxins, but their actions varies. So we have to compare the remedies when we learn, and that's where the relationship plays very vital role. Compare also the Peleus and Lachesis. Peleus is not well proved remedy, so don't go for that. But Lachesis is sure. But Lachesis is a constitutional defecting remedy. Certain times in renal toxicity it works, but you should be very cautious whenever you are using like cases like remedies, constitutional remedies, specifically when patient is in acute renal failure or when patient is having a serious pathological condition. Don't go for constitutional at that time immediately, unless and until you are damn sure about the remedy. And even though if you are using them, don't go for the centesimal scale. My suggestion is that it's always better to go for 50 millisimal. Let us give the remedy in 50 scale so that it will not cause damage to the patient. Pathology never gets advanced, aggravated because of using the mild potencies like LM potency. So my suggestion is always that you must consider the potency whenever you are dealing with pathologies. And last, what he says in doses, attenuations are made by with glycerin or distilled water. The lower 1x to 3 in heart diseases, the higher in sudden renal attacks. So in heart diseases, you must think for lowest potencies in decimal scale. Generally, if the pathology is advanced, better to give it in decimal scale only. Repeat it till you find the desired results, and once you get the results, stop giving the remedy. This is the very important thing. But serum angular is ichthyotoxin or L serum, you can repeat for a longer time of duration also if you give it in 7x or sometimes even in 12c or 30. So this is a very important remedy in your practice, helps a lot, and you can confidently bring certain types of patients out of danger with the help of L serum. It definitely used to produce a diuresis in such types of acute renal failure cases. Don't forget to read this again from the Boericke Materia Medica. Revise it again so that it remains in your mind forever, and it will be recollected whenever you will going to prescribe. So thank you very much for this session. Again, we'll meet whenever the time permits. So with one more remedy, but we'll see these clinical cases along with that so that we can discuss. Okay. So thank you very much for attending the session. We'll meet whenever the time is possible. Thanks a lot.